Welcome to the Helsi podcast, where we invite you to invest in your well-being and unlock the secrets of vibrant health, peak performance, and wellness. Join us, Sebastian and Johannes Kettelhout, co-founders of Australia and New Zealand's leading wellness company, as we dive deep into the science, strategies, and stories that empower you to live your healthiest, happiest life. Whether you are a CEO, high achiever, entrepreneur, elite athlete, health enthusiast, scientist, or self-improvement seeker, together we will explore the cutting edge of biohacking techniques and holistic health practices with world-class experts that optimize your mind, body, and spirit. With each episode, you will walk away with practical and actionable steps to integrate in your daily life. Are you ready? Let's elevate your well-being.
Hi, everyone. I recently joined a session at a medical center observing how medical doctors actually assess issues of their clients that come in. But as part of the center, they had another 20 more alternative doctors that were also part of the team. And they discussed the issues that they would see. And of course, in the world we live in now, often the medical system is not really equipped to deal with things that are more upstream, sort of probably what people would call sort of like people's wellness and the overall lifestyle diseases. The reality is that the medical system deals with the results of something that can actually often be addressed much earlier and identified much earlier. And I think that's where our world really moves into, is that people are interested in not even getting sick. It's a little bit like you think about a house on fire. When the house is on fire, you need the fire brigade, which is like a medical doctor. But if there is no fire in the house yet, but you have the precursor of like not safe fireplaces or electrics, at that moment, the house is still not on fire. So fire brigade can't do anything, but there's still that risk, and eventually it might lead to actually the fire. So you talk about electricians, you talk about people that understand fireplaces. If you transpose this into the medical system and in the wellness system, this is exactly what we're dealing with. It's like a lot of issues, and referring back to the session that I was part in, a lot of issues could have actually been addressed much earlier, but the awareness is not, broadly speaking, in society to figure out to address something before it becomes a massive issue, meaning cancer, meaning anything overwhelming that really stops people from having a good life. So Crippen, Dr. Jeff Crippen, is with me today, who has looked into the physical, but also the non-physical, and especially upstream issues that can prevent, if you address them early, having to go down the traditional medical route. Welcome on the show, Jeff.
Awesome. It's a pleasure to be here. Sebastian, excited to be here with you and your audience, and looking forward to a fun and adventurous conversation today, I'm sure.
Amazing. So you wrote a book called Timeless You. What drove you to write a book like that?
Yeah. So a little bit on the backstory of that is I hated English class. It was like my least favorite class going as a child. And then when I went to college, I almost dropped out of college. And then my parents tapped me on the shoulder and said, "You shouldn't drop out of college." So then I said, "Okay, I better not." But so I then looked at about 18 different majors in college, including having no major, creating my own major, and a general studies, which is like, basically that no major. And the only thing I was sure I would never major in was English. So anyway, the idea of me writing a book was not the first thing I wanted to do. So, but to answer your question, what drove me there was an incredible sense of passion. It drove from an intention to be able to help more people and expand the reach outside of what we're doing at our wellness center. We've got a coaching and leadership center here. We're about an hour and a half outside of Dallas in the United States. But I wanted to expand what we were doing more, because I saw too many people going through the medical system, the disease treatment system that is, the fire brigade, as you so eloquently named it, and they were getting sicker and sicker. There's a study by Gary Null called Death by Medicine. And what he did is looked at the most common cause of death. And we know in the United States, I got some stats for the United States, cancer kills about 600,000 people a year. Heart disease kills about 700,000 people a year. And what they found was traditional medicine, the medical system, kills about 1 million people a year. So it was the number one cause of death. And actually, they've done some interesting studies around the world, including Israel, California, New Zealand, and they actually looked at what happens to death rates when doctors go on strike. And it's not an easy thing to measure because it's not easy for doctors to go on strike, right? They're like, life-saving things. So when a doctor goes on strike, what typically happens is they're allowed to, they continue providing emergency care. They continue to be the firefighters, but it's all elective surgery, all quote unquote preventative stuff in the medical system that gets canceled or postponed. And what happens when doctors go on strike, the death rate stays the same or goes down. So that means when your doctor goes on strike, less people die. I was looking at another study from a few months ago that looked at elderly patients on prescription drugs. And what it showed was, the average, take the average elderly person on, 5 to 6 prescription drugs. If you take them off 2 to 3 drugs, they live longer and have fewer side effects. So we all know this kind of intuitively because they're getting closer to health. That's the antithesis of what's happening in the medical system. So I say all that to say the medical system is killing 1 million people a year, and yet we're asking the wrong questions about what health is. And that's what I wanted to do, with this fundamental paradigm towards disease treatment that's actually the opposite of healthcare. And that's what I wanted to open people's minds to and contribute to a more healthier planet. So that was the intention behind the book, is to create a real positive ripple of truth to help people latch onto that and live a happier, healthier, more fulfilled life.
That's amazing. And so what are the cornerstones that you found when it comes to preventative health?
Yeah. So what I wanted to look at is I broke the book down into, I broke the book down into 5 different principles, and I'll get into those. But the reason I say I talk about principles because every 2 weeks or every week or every day, there's a new supplement, there's a new fad, there's a new trend that happens in the wellness industry. And some of them are great stuff, but it's still this mistake. It's like the magic of the acai berry that we're going to fly from Brazil over to something, right? Which is great. There's a lot of health benefit in it, or it's this superfood, or it's that potion, or it's that supplement. And I said, just wanted to go back to first principles and say, hey, we've survived on this planet for millions of years, right? We've evolved. There's a natural innate wisdom that's guiding us. And there's a gentleman named Weston A. Price who did a lot of incredible work on this. He traveled over 17 different countries. He did some work down with the Maori down in New Zealand, among other places. And basically, he looked at the native diet, as you and probably a lot of you readers or listeners are familiar with. And what he found is there was no magic diet, right? The Inuit in Alaska in the U.S. ate very differently than the people in the plains of Africa, ate different than the highlands up in Scotland, ate different than the Maori in New Zealand, or different than Japan. But what he found was a couple of principles. And what he found was he didn't find any culture that was 100% vegetarian, right? They all had some form of meat product, and they all ate local, and they all ate off the land. And what they found is when you compare that diet, as varied as it is, those 17 different diets that were evolved locally with the land, they all have 2 to 10 times the recommended daily requirements of nutrients, right?
Wow.
2 to 10 times the vitamin C, the vitamin D1, the vitamin B2, right? Yes. You go through all the nutrients, they all had them, which makes sense because otherwise they didn't have what we needed. We would have died. But when we compare that to the official diet of the American Heart Association, the American Diabetes Association, the DASH diet for hypertension, what we find is those diets have 20 to 80% of the recommended daily requirements. So the natural wisdom of the native populations had a diet that was 10x roughly more nutrient dense than the diet from our medical authority. And they probably weren't reading 500-page nutrition books back then because they weren't written. It was passed down through tradition. It was passed down through culture. It was passed down through an intuitive knowingness that they had within themselves. So a lot of health is actually getting back to what we already know and getting away from searching for the latest trend. So everything, as I was thinking about the principles that create health, I always wanted to kind of backtest it in a sense to say, this is something that would have made sense 200 years ago or 500 years ago or 5 millennia ago, to kind of go through that. So, I break them down into a little more specifics in the book, but on a high level, the first thing I look at is the principle of holism, right? The whole is greater than the sum of its parts, right? And we can look at that on a bunch of different levels. Like on a relationship level, we know the importance of social connection. We know that people who have 2 to 5 friends live longer, have lower rates of heart disease, right? We know that foods that are whole in nature are healthier, right? Sugar cane is a lot healthier than white refined sugar, right? An apple is healthier than apple juice, right? We can look at that on that level. We can look at that on supplements, right? Synthetic vitamin C that's, made in the lab from, basically petroleum is not that healthy when you compare it with, broccoli or something that's high in vitamin C. So anyway, you can look at the principle of holism, and the opposite to reductionism, right? Which is a principle of traditional medical system, which is break down things into the smallest parts and pieces. And we can look at the next principle is what I call the Model A principle, or the power of individualization. And what this says is you are very different than I am, which is very different than your listeners, which is very different than our parents, our friends, right? And we kind of all intuitively know that, right? None of us can buy a rain poncho that's one size fits all and be happy with it, right? So if it doesn't work for something as simple as a rain poncho, how is it going to work for diet? Right. But some interesting research was done by a gentleman named Roger Williams that I found really fascinating. He was a PhD professor at the University of Texas down in Austin. And we were just talking before about you traveling there a couple times a year. But he actually discovered 2 B vitamins, and his brother discovered a third. So he was, he's a pretty big deal in the area of nutrition. And he wrote a book called Biochemical Individuality. And what he said is that individual nutrient requirements, and he found and he studied and he proved individual nutrient requirements can vary up to 100x person to person. So the amount of vitamin B you could need versus me could vary not by 10%, not by 100%, but by 100x or 10,000%, which intuitively kind of makes sense, right? In the sense of like, a weightlifter is going to need a lot more protein than someone who's small. If someone's, weighs twice as much as someone else, but 100x is incredible. That takes that to a whole different level. And what they've seen is, we saw an example of that. One example I think we saw of that with COVID was the loss of taste and smell was a common symptom of that. And that's a sign of a zinc deficiency. And what the body will do in a very proactive and intelligent way is it'll triage the zinc. And it says, hey, I only have a certain amount of zinc. Do I want to use that zinc to smell and taste, or do I want to use that to inhibit viral replication? And what the body was doing very intelligently, triaging that that zinc, towards inhibiting viral replication instead of towards, taste and smell, and said, hey, we can still live if we can't taste and smell. If we don't handle this virus, we can't. So anyway, you can look through that. There's some other work done to this. It's called triage theory. It was done by a gentleman named Bruce Ames, who's done some fascinating work in the area of things like vitamin K and magnesium. Just looking to the standpoint of the body will send vital nutrients to their most needed area. So as we repair micronutrient deficiencies, we can get benefits immediately, right? But we also can get benefits that don't become obvious for 3, 5, or 10 years because we're doing things like repairing cellular DNA or strengthening blood vessels or making our bones stronger. That may not be issues now, but may show up as issues as 5, 10, 20 years away. So anyway, I go through that principle of individualization. So the Model A principle, we're not one size fits all machines, and yet the traditional medical system often assumes we are. And that's the only way you can do a 3 to 15-minute doctor visit, is you have to assume the patient is 99% the same as the patient that came before. Because if you really start to explore the differences, who you are, what are your goals, what are your dreams, what was going on in the area, that's a conversation that can't be done in 3 minutes or 5 minutes or 7 minutes or 15 minutes.
What I see on that, I would love to go a little bit in the technicalities at a moment, but like what I see on a macro level is one of my dearest friends is a pediatrician, has studied all his life, great specialist and so on. But I remember sitting with him down while he was still studying in our 20s and asking, how about nutrition? How much do you learn about nutrition? And he said, well, overall in the 7 years, I have 20 hours of nutrition. That's it. And to me, that just doesn't make much. I'm always surprised because if you think about it, these are building blocks for the body. So they're super important and they affect so many things. What should and what shouldn't you eat? And at least 20 years ago, that was normal to not learn much about it. And I just wonder, one with all the technical advancements, sensors, tests that you can do nowadays. So there are tools out there now, right? And then the advanced knowledge, like you pointed out, with B vitamins, with the K vitamins. does it actually lead to a better medical system, or do we just have to accept, look, these are two different things. Eventually, way in the future, maybe it merges. But right now, the training that medical doctors get is just the fire brigade training. And we accidentally gave them also many other jobs that really should sit with an alternative to the traditional medical system, simply because they can't address it. As you say, like in 5 or 15 minutes, you can't really figure this out. Even if you do all the tests in advance, you really have to figure out the individual person, right?
I'm so glad you said that, because that's actually one of the things I was thinking about that led into your early question of why did I write the book? Because I was fascinated by that question. We have some of the brightest people in the world, some of the most incredible technology. I mean, the speed with which they could do blood work, like a CBC or complete blood count, I get that ordered for $6, and they're counting all the red blood cells, all the white blood cells, the size, the shape. They can break down the white blood cells into 5 different types, count those, give them as a percentage of total, right? We can look at platelets. This is just the most basic, that's one part, the most basic test of blood work, and that can happen in minutes. And I can get the results back in my office in 24 hours, right? And now we can look at CT, we can look at X-ray, we can look at 3D models of the heart. And so we have incredible doctors, incredible technological advances. We have great academic institutions. We have a lot of people in that system who care. And yet it's the number one cause of death. So how could that be possible? Similar to what you were asking. And I was fascinated about this. And the two analogies came to me. And the first one was, I'll start real simple. It's just basketball. I like playing basketball as a kid. And what if you had the best trained athlete, strongest, fittest, great 3-point shot, great defender, but they had one wrong piece of knowledge. And that one wrong piece of knowledge was which basket's theirs. So instead, right?
Yeah.
It's pretty obvious what's going to happen. So instead of scoring in their basket, they're scoring in the other basket. And what's the other team going to do? Let them go. And and you can't fix that problem by making them more fit. You can't fix that problem by improving the mechanics on their jump shot. You can't improve that by making them better defenders. The only way you can improve that player at that point, or the most effective way, is change the fundamental misconception that they have underlying it. And the reason I wrote this book is I thought the fundamental misconception we have as a culture, as a society, is what is health. We don't understand what it is. And if you don't know where London is, you can't get there. Right? If I don't know where Byron Bay is, I'm not going to make it to you. Right? I mean, it's just real simple. So the example I gave, and actually started out the book, was the analogy was the Titanic. Right? It was literally the biggest. It was the best. It had the best technology of the day. It had wireless transponders that could go, up to 1,200 miles at the time, which was, the best in the world. There was in the previous 10 years, there had been, I think, 6 million miles of oceans crossings and not a single fatal accident. And yet the Titanic, the supposedly unsinkable ship, crashed on basically its maiden voyage. So how was that possible? Right? It was, and I go through, we can talk about it ripping in the hull. There's theories about maybe the steel was sub quality. There's another theory that maybe the binoculars were locked in the supply closet, which I can't believe that was the reason it sank, but there's a whole, as you can imagine, it was a tragedy when it happened. And there was investigations on both sides of the Atlantic trying to figure out what it is. So I go through all the reasons they said, the top 10 reasons they established. But underlying all of that, it was basically a misperception that the ship was unsinkable. That's why the captain, his mate, sped through the North Atlantic. He hit the iceberg when there was other ships basically crossing the North Atlantic at that same night, and nobody else sank. And they didn't have 10 years previously, including one of the Titanic actually had 2 sister ships, the Olympic, the Titanic, and one other ones that rhymed with those. But and one of the Titanic sister ship was up to only a couple 100 miles away. And it didn't come to rescue survivors that night because the captain said, "Don't come." They thought it's going to be too traumatic to see an identical ship to the Titanic pull up as the Titanic was sinking. So that's part of the reason people got on the Carpathia, which was further away at that night. Anyway, just as a small example, but it was that hubris, that misperception that it's unsinkable, that caused it to go too fast, that caused it to not take not take a more southerly route to go through an area where there was no icebergs. I mean, but everyone else made it safely. So why did the Titanic, despite the best technology, despite good intentioned people, sink? And my fundamental contention at the beginning of the book is a misperception that caused all the downstream effects of that. And that's what I think has happened in our medical system. It's a misperception. If you don't understand what health is, we sure as hell can't get there. And I think that's where we start.
Yeah, that's an amazing analogy. I often think about, well, the misperception maybe could be stated for the medical system is like, that's the answer. The Newtonian way of just looking at the small part, but not at the bigger picture of like, what environment do you live in? What's your history? What's the family that you grew up in? All of that, societal things, but so many other things all contribute. And if you look at society and you ask the same question, I heard actually about the Titanic also, that if you have a misperception that you're not sinkable anyway, then you will focus more on messages. Like I heard messages between passengers rather than actually making sure that there's an alarm system that sits above it. And I look at society nowadays, and I've studied quite a bit of ancient societies. It's quite a common thing that they hit the basics down. They could have kept going, but they were completely off the focus just shifted so much to things that just aren't actually it's not the true concern. It's something that you could do on the peripherals, but you have to keep focusing on your basics no matter what. And it sounds a bit like, ask the medical system, are we actually serving, humanity and public health, or, health in a wider realm or not? And I don't think it's asked, because it's just, well, slowly it is, but we certainly come out of a time where there was just not a topic. It's like, of course, it's the doctor who knows best, the traditional one.
And the medical system makes sense if you consider it not as a healthcare system, but as a disease treatment system. Right? Then it all falls into place. The mistake we make is when we conflate that with health. Right? Taking a drug to lower blood pressure is not health. Right? The reason you have high blood pressure is not a pharmaceutical deficiency. Right? I think we can kind of all agree on that. The reason your knee hurts isn't because of a Tylenol deficiency or an aspirin deficiency, right? So the whole system is a disease treatment system, and that can be great and that can be useful, just like the fire brigade is useful, used in the right place. But if you're trying to build a house, don't call the fire brigade, because they're going to show up with axes and shovels and water, and you're going to have a mold infested house with holes in it, right? And broken windows. You can have a whole bunch of problems. So the mistake, I think, is using the medical system for something other than its intended purpose, right? If we use it for disease treatment, it's one of the best in the world, and it does that phenomenally. If we use it to create health, we're going to have a bad time.
Charlie Munger always makes this joke that for a man with a hammer, every problem looks like a nail. And that's a bit like that. It's like, maybe we have a very different problem that actually the medical system as it stands, they don't have tools for that. And I believe that's true, quite widely true. It's just, and it starts with the education, right? And that's something that I found is really important, especially if you talk to people who look for alternatives. It's not a nasty, evil system. We created the system, like, yes, of course, there are interest groups, there's money that sort of shifts a little bit the needle. But overall, if the doctors that I've met, many of them are not doctors because they want to make money. And they certainly aren't in it for like screwing up, like, humanity. Yeah. What it is like, there's an education system that has been built to educate on really specific topics. Unfortunately, these are not the ideal topics to really fix more than acute issues right there. And unfortunately, sometimes diseases and symptoms are also mixed up, which is that there's no looking upstream. Well, where did this even come from? Is this really the issue, or is this just a symptom of something else that happens? And to me, what I just found strange is, are we starting to change this? Because it seems to be pretty obvious.
Have you heard that idea that doctor comes from the word to teach? Have you heard that idea that the root word of doctor is docere, which means to teach? In fact, they'll talk about that. So I actually looked at it. And the root word docere, which they said means to teach, actually comes from the same word as indoctrinate. So it's actually doctor and indoctrinate, obviously very similar. So they share the same root. So it comes from the root to teach, but in the sense of, I will tell you what to think, this top-down authoritarian kind of teaching, as opposed to maybe the ideal of a Socratic method of asking to find out answers that are within. So, and I think that connects to your point of what you were saying of what are the doctors learning, or we need to go back to the education, and we can connect that back to the point you were making earlier about nutrition being a marginal piece of their education, optional in many cases. There's this indoctrination that happens to our doctors, as opposed to going back to those native cultures that West and Price study. Or that's actually true for all of us. There's this natural wisdom that's within each of us that's enabling us or pushing us to survive and thrive. And so something that I was written, but I didn't end up in the book, was the difference between doctor, which comes from the root word indoctrinate, and healer, which, the root word comes from something called, or the root word is kaleo, which means to make whole. So healer is someone that makes whole, right? Or educe, and the opposite of indoctrinate would be educe or educere, which means to draw out what's within. And that's the idea of that Socratic method. So often medical education, like most education, is very indoctrinated, top down. I'm going to tell you what to think, and you're going to take a test at the end of it, versus educing or drawing out, or come to that Socratic method that can really tap into that natural wisdom, or helps the student develop their own viewpoints on an area. Anyway, that's gone. Go down to education, but I think it connects to your point on how that medical system's created, because it's created with a top-down kind of approach and a set of beliefs, and it could be quite painful for doctors who then decide, hey, maybe all of this isn't true. There's this quote from the dean of Yale Medical School, and it was quoted by Lisa Saunders, who wrote for the New York Times. She wrote an article called Diagnosis. This was the basis for the American TV show House. You might have heard of this doctor who goes in and he's solving, these most complex cases. But she quoted the dean at the white coat ceremony on her first day of medical school. And the dean told Lisa Saunders, and she writes about this in that article in the New York Times. She says, 50% of what we teach you in medical school is wrong. The only problem is we don't know which 50% it is. And that was the dean of that's not you or I on the podcast talking about. That's the dean of, it was either Yale or Harvard Medical School. So it was, a well-known place within that field, right? And they're saying 50% of what we teach you is wrong. The only problem is we don't know which 50% it is. Welcome to med school.
Wow. That's unbelievable.
Yeah.
When you contrast this, I guess, modern medicine, if that's the term here, with sort of more ancient systems like the classic Chinese medicine or Ayurveda and so on, if you compare that, would those older, well-established systems have a more holistic view and actually overall help more when we don't talk about emergency surgery, all of those things?
I've studied a little bit about traditional Chinese medicine. I've studied a little bit about Ayurvedic medicine, or the traditional medicine of India. So I am far from an expert, but certainly familiar on a surface level with some of them. And I think both of those have the idea of holism built in as a major part of it. Right? Traditional Chinese medicine is basically built on the flow of energy. They call it qi. Right? The Ayurvedic healing system is based on basically the holism of the doshas and just seeing how those interact with each other. But one of the things I get to, but what I think we find in almost every traditional healing system is this idea of what I call towards the end is the golden you principle, or the power of the infinite you. But this incredible, in chiropractic school, we called it innate intelligence, which is the inborn wisdom of the body. Then we talk about universal intelligence, which is like the natural wisdom we have in the universe. So that may be called, in other healing traditions, that may be called God, that may be called the universe. In Ayurvedic medicine, they call it prana, right? The Chinese call it qi. The Polynesians call it mana. The ancient Germans called it od, right? This all pervasive organic energy. And no matter what we call it, no matter what culture or creed It is a lot of these traditional systems, we found this spiritual element within it. So I think as soon as you add that spiritual element back into it and you stop seeing a patient or a client or a friend as just a body, I think by definition, you're a huge step of a way towards holism because you're starting to see that patient as a whole person, a whole being, spirit, mind, and body, right? And that'll show up as, that'll show up in Christian philosophy as the soul, New Age parlance, maybe consciousness or awareness. And I think it's less important about what we call it. But the idea is a lot of those traditional systems have it. A lot of the traditional systems of healing, have it. And as soon as you add in that spiritual that spiritual essence, you are a heck of a long way towards holism at that point.
Yeah, and if you think about diagnostics, if you believe that what sits in front of you, as a doctor, has a spiritual side and is a much wider sort of person in that sense than just the physical, at that moment you would consider other things. And if you think about it, like you can change your heart rate with thoughts. I've seen it, like people get anxiety attacks by just thinking about something that happened in the past. Might have been an accident, might have been whatever, it doesn't really matter. And the heart rate increases. If you go to a medical doctor and the medical doctor doesn't ask questions around your being about, the past, but just sees the heart as having, too fast pulse, then you go on the meds. But that has nothing to do with really the issue, which is really like, okay, you had a car accident and you still are traumatized from it. Let's actually work on that. And that will fix the heart rate that you got. And it sounds really simple. And of course, when you're in the field, it's really complex and the system doesn't help of having just 5 to 15 minutes or something like that to figure it out. But overall, it's fairly obvious that the spirit and the mind has a lot to say in terms of what the issues really are.
Yeah. I just thinking back, a podcast you did a couple of weeks ago, where a gentleman who's got the Hippocrates Healing Center down in Florida was talking about, just the idea of Brian Clown. Yes, exactly. Thank you. Just the idea of being present, whether it's meditation, whether it's presence, whether it's gratitude or prayer, increase the immune system 40% in 5 minutes, right? Just as an example, we don't have, right? Nothing physically changed. One of the things I talk about in the book is, heart attacks or strokes. And there's something like an 1,800% increased risk of a heart attack after a loved one dies. And what I'll guarantee is the cholesterol level didn't change markedly from that point. Neither did C-reactive protein, neither did omega-3 index, right? We can look through some of the stuff that didn't change. What did change is stress, 100%. One of the ideas I like is, stress is kind of an ill-defined term, but let's look at the idea of mood level and just an idea for mood level or the emotion someone's feeling: happy, positive, sad, excited, downtrodden, sad, depressed, beat up. That mood level, we can just think as energy flow through the body and just flowing at different particle speeds, right? Anger has a different vibration than joy, than serenity, than sadness, right? And what they've shown, just some research has shown, optimists live about 7 to 15 years longer than pessimists, which is a pretty amazing thing, right? It's hard to find a medical intervention that'll add half a decade to a decade and a half to your life. And especially when you consider things like maintaining a healthy blood pressure adds about 4 years to your life. So a great thing, right? Not smoking, maintaining an ideal weight adds about, and exercise, all add about 1 to 3 years to life. So the increase of lifespan with optimism is somewhere between 2 and 7 times more powerful than those. And let's look at those. Those are checked on pretty much every routine office visit in the disease treatment system. Do you smoke? What's your blood pressure? Do you exercise? What's your weight? Right? That's some of the most basic stuff. And those things should be checked because they're important. And yet, here's something that's 2 to 7 times more important that's just totally being ignored. Or if you have problems with your mood, the disease treatment intervention for that is an antidepressant. Take 2 and call me in 6 months kind of thing.
Wow, that is a very different approach.
Yeah.
Where do you see, like, what would be your ideal world? Like, what should be, like, from a governance point of view, what should a country really prioritize to create a support system, let's call it medical system, healing system, that would really move the needle and really change how healthy people are?
Yeah, I think that's a really great question. I tend to be more of I lean towards less government is more government kind of thing. But I think there
Mhm.
certainly is a role for government. And I think it's laying the foundation or creating the structure or matrix, if think matrix like the mold, the form, creating the matrix or the environment for health to be created. So what's important for that? Well, I think honestly, just the basics, things like clean water. Like I've gone down, traveled to Mexico, speak down there, have some clients down there, and you just like realize what an act of sabotage it is to have dirty water. Now I'm in the US, and, we have clean, drinkable water, but it's
Mm,
still poisoned with aluminum and chloride and all
mm,
sorts of stuff like that. And pharmaceutical drugs are in there. So, there's different levels of poison, certainly, depending on where you are. But things like clean water, clean air, right? Trees, natural spaces. Like I think just creating some of that context there. I think a major factor we have now is there's two countries in the world that allow drug companies to advertise. One is the US, the other one is New Zealand, right? So drug company advertisements and some of the major TV stations could be, 30 to 50% of their revenue. So that's going to create some real
bias?
misincentives or disaligned interest, right? Ask your doctor about blah, blah, blah. And then they show a
Yeah.
picture of like a woman dancing while they speed talk all the side effects and include everything up to death. Right. So I think it's just I think it's just creating that foundation for that. Another thing is, farm policy in many countries of the world. I mean, I think Europe does it well, like with the fact that just GMOs aren't there. I mean, the food supply in the US is illegal in something like 60 countries. Right. I think just things like that. So genetically modified foods are sold, you know, all the time here. In the United States, I'm familiar with that a little bit. We subsidize GMO sugar, which is basically corn, GMO corn, which
Mm,
basically turns into high fructose corn syrup, it turns into sugar, and GMO soy, and we're subsidizing that all day, every day. And yet, things like organic vegetables, right, are twice the price. So you're a family on a budget, and
mm,
a soda is going to be subsidized, whereas water is not, right, in a sense. So you're going to be creating kind of those misincentives there, and then you're driving families to buy water because the water that comes to their tap that they're paying for every month isn't drinkable. So I think it's things like that that just creating some of those basic foundations. And then, I also think you got to look at the incentive structure you have, which is, something like 90 to 95% of all the treatment dollars for healthcare are spent in the last 6 months of life, right? So you have to look at if we're going to spend, $50,000 per patient or $100,000 per patient over the course of their lifetime. Do we really want to spend 90% of that in the last 6 months of life? Or does it make sense to, incentivize, health much earlier on? So those are the kind of conversations I'd
yeah.
start to look at. But just creating that foundation and just creating a foundation of context. And there's a lot of misincentives in the system that I try to clean up.
Have you thought about a blueprint of, I guess, a healing clinic that would have a more holistic approach? How would that patient experience be?
Yeah, I think it starts with a really good history, right? And I think that first history, we'll schedule an hour for that first visit. And honestly, that's what we do in our office, and that might not be enough. But I
Mm,
think to really understand what a patient is, and you gave the example of blood pressure earlier. One of the questions I like to ask connected to that is, um, what was going on just prior to that starting?
mhm,
So what was going on in their life just prior? And sometimes it may be toxicity, sometimes it may be a move, sometimes it
mm,
may be a change in a diet, sometimes it may be a gain of weight. So physical things can contribute to that. And in addition, it could be stress, it could be a fight, it could be an upset. Oh, and by the way, it could be most people get high level from their doctor and they're put on a medication. Yet you should never trust one blood pressure reading by itself, right? And there's some common misperceptions that aren't
mm,
done. So I'm always talking to my patients. There's the main study. It was a lot of the blood pressure was based on with that general recommendation of 120 over 80. They were taking blood pressure like 2 to 3 times a day for 2 weeks, and they averaged the total. And then what they did is they had the patients sit down for 5 minutes, breathe, relax before they did the blood pressure. How many doctor's offices is that happening at? Well, approximately zero,
mm,
right? And then no caffeine or no alcohol. No caffeine, probably no alcohol, but no caffeine or no exercise within 30 minutes of taking your blood pressure. You're sitting down, both feet on the floor, excuse me, and not have to go to the bathroom. And that's how you take your blood pressure. And that's your first reading. And then do that another 10 to 40 times over the next 2 weeks, average that number out, and that's your blood pressure. So this idea of one number is nuts because our blood pressure, our body's dynamic. When we're lifting weights, our blood pressure will spike to 150 or 180, right? And under stress, it'll change and things like that. So there's actually best practices to do that. So going back to your question, it's really finding out what was going on just prior to this. And I think a lot of it has to do with education. And by educating, I basically mean undoing the miseducation that was there. And this is, to go back to your original question, this is another intention of writing the book, is to open up these conversations with patients. Because if they've been indoctrinated, to use a word, into this idea of, I have high blood pressure, I need a drug, or I need herbs, I need a Tylenol, the idea of asking, well, tell me about the stress that was happening in your life, or what was going on just prior to this. Or I go through, there's a study, one of your recent guests mentioned Gabor Mate, right, in some of his books.
Yep.
And he references a study called the ACEs study, or the Adverse Childhood Experiences study. You familiar with that one? And basically, he was looking at 10 most common forms of childhood trauma and its correlation to disease. Right. And how that started was the doctor was head of Kaiser Permanente, which is a big insurance company here in the US, especially on the West Coast, their obesity clinic in San Diego, California. And what he was interviewing the people because they had a 50% dropout rate. And he was curious. So why are people dropping out of this program? And what he found is most of the people dropping out were losing weight. So he said, okay, this makes even less sense. It was Felitti was his last name, Victor Felitti, I believe. So he was asking, why are these people dropping out if they're losing weight? So we interviewed him, right? Novel idea. And he asked him, why are you dropping out if you're losing weight? Wasn't that like what you want? And just to put some context around, this is an obesity clinic, not what people are, it's obesity. It's not a weight loss clinic. So it's not people trying to lose 10 pounds and get in shape for a bikini. It's like 30 pounds minimum, but 50 to 200, 300 pounds is kind of the weight loss that's happening there. And what he found with these people is they said, yes, we're losing weight, but you don't understand. It's not about the losing weight. It's about we're using food to cover up an emotion, to mask a feeling, like somebody might use alcohol or like somebody might use a drug. So he got curious about that, expanded the study to 17,000 people and did this adverse childhood experience study. So they looked at 10 types of childhood trauma, and they were physical, sexual, emotional abuse, physical, emotional neglect, exposure to domestic violence, household substance abuse, household mental illness, parent separation, divorce, or an incarcerated household member. And what he found was, compared with an ACEs score of 0, compared to somebody who had 0 forms of adverse childhood experiences, somebody with a score of 4 or more was associated with a 700% increase in alcoholism, a 200% increase in cancer, a 400% increase in emphysema. A score above 6 was associated with a 3,000% increased risk of attempted suicide. So what I had to think about at that moment is, how many of my patients, when they have emphysema, go to their doctor and they're being asked, how much emotional, or physical, or sexual abuse happened there? But yet we know that it's a 400% increase based on the stress, based on those ACEs. So I think, to answer your question, I think that ideal healthcare system has to recognize that, has to recognize the power of these non-physical factors. And, just from a practicality standpoint in the office, the patient also has to be knowledgeable about that. They have to be willing to have that conversation, and they have to be open to it. And I still think about all the time and the best ways to do that and meet them where they are. But we work with people who are open to it. And there's some people we're going to work on the physical level. There's some people going to work a little on both. And there's some people that are going to say, hey, and they're going to really go through there. And then they're going to have things like digestive symptoms go down 50%, like within minutes, right? And you have released the shock. With one lady, I asked the question. So it was then obesity. I asked her that question. So when did it begin? And one thing Felitti found, he also found that, if somebody's 300 pounds overweight, they're not gaining 30 pounds a year for 10 years. right? They often come in big jumps, 50 pounds here, 20 pounds here, 60 pounds here. They come in like kind of stair steps up. It's not this gradual progression. So I was trying to ask her about it. And I got this story of basically being raped at gunpoint by her ex-husband. I was thinking about this study and thinking about that. We took her through a process to handle shock. Getting back to a long conversation we had before we started, which was abuse and trauma and things like that. But we took her through a process on that, and she dropped 22 pounds in 2 weeks. And I guarantee you it wasn't physical weight, right? She had
Yes.
some weight to lose, and her goal was probably to lose. She told me it was to lose 50 or 70 pounds. Later, I found out once she lost the first 60, it was to lose 100. So she had some weight to lose. But she dropped 20 pounds in 2 weeks after being stuck for a while. And it was because, anyway, it was happening more of that level. So I think you have to include that part. And connected to that, you'd have to include an education program for a patient if they want at the right gradient when they're reaching for it. So it really is more of an adductive process and not an indoctrination, right? Because I definitely would want to make sure that's there, but for them to understand that connection and when they're ready and as they understand more, reach for those pieces to help them at a deeper level. So anyway, there's probably a lot more to that question. But I'll stop there and give you a chance to respond, and then we can go next. But I think those are some of the key components we have to have in some of a more optimal wellness-based system.
Yeah, I think that's super powerful. And if I think about where that all starts is the overall acceptance of a patient or just of us in general, even before we go to a doctor, that certain things in our lives that have nothing to do with our body straight away have a huge impact on our body and on our health. And I think when that is acknowledged, then people would scan their history also very differently. If you have a hip problem, it doesn't necessarily mean that there is something physically wrong with your hip, but it could actually be. I've met someone who had the feeling that they drowned when they were sick. It might have actually not been really the situation, but she had the feeling, was laughing and letting her, and then sort of in her 20s, she somehow addressed that, like, just worked on herself and on her emotional state. And as part of that, there was a conversation to be had that the psychologist or therapist suggested, talking to the dad. She talked about this particular incident. He clarified what was really going on. For example, it was just 20 centimeters of water. You would have never drowned. Just felt like that to you. And she had a hip problem. She couldn't run. And, within a couple of days, the pain was gone. And I don't want to sort of trivialize, that of course other things can happen, but this is one angle to look at it. And sometimes you strike gold, meaning you actually find a solution that has nothing to do with your physical body. It has something to do with your trauma that you had as a child. And there's so much more. And what I want to say to the listener is also, like, just be open to that possibility, because it's a really easy win. If you actually figure out, great, all I have to do is going to a tapping, doing a tapping course. Like I, for example, did a tapping course, and I fixed quite a few different child misperceptions and also just grudges that I held. And then I realized this doesn't feel right. This tool helps me to let go of it, and the relationship improved with the parent, and also I just overall a lightness coming in there. And I guess, to finish my response there, it's just, if you go all the way and really look at it holistic, give people tools or people looking for tools that can just scan their emotional landscape and history, there's a lot to be gained. Like, there's a lot of happiness to be gained and longevity as well, if you actually start this journey and take it as your responsibility as a patient too. It's not something that you can outsource to a doctor. You have to do the work.
Yeah. Absolutely. You raised some just fantastic points there. Yeah, I think we talked about this maybe just before recording, but if not, the listener did hear it twice. But it was, we were talking about, so we talked about the first two principles. The third one, we've talked a little bit about, which is the quantum principle, which is the power of the intangible to affect the tangible, right? That's the third principle I write about in the book. And the story I tell at the beginning of that is the story of fifth grade science project, where I had to make an atom. Right. And I took a mini basketball and pasted little coins to it, and then bent coat rings and made circles around it to represent the electron rings, and pasted other coins on that. So I made a little model of an atom and took it in. That was based on this model doesn't really matter the name, but by Bohr, who's a
Mm.
Danish scientist back in the day. But what we now know, what quantum physics taught us, is that model is totally outdated. Right? What we know is if the nucleus, instead of a mini basketball, is the size of an apple, right? The closest electron would be a grain of salt, and it'd be 2 kilometers away. So that atom that we think of is literally, the Greek word, it comes from the word meaning indivisible, right? The smallest unit of matter. Well, now we know it's, you can break things down to smaller things than atoms, right? But the atom, which is the building block of everything, it's a building block of the tables, chairs, roof, building I'm in, like the structure you're in. And yet we know that's made of atoms, which are made of protons, neutrons, electrons. And we know that atom is approximately 99.9999999, roughly, percent empty space. Yet obviously it's not empty, it's full of energy.
Mhm.
Right. And that's why a tornado, for example, can have incredible power, yet not actually be matter. It's just energy. Right. It'll move matter, it'll move a car, it'll move a house, it'll move all kinds of things, but it's just energy. So we're actually, just like the tornado, we're built out of 99.999% energy. So that's how, when we look at things like mood level and optimism, when we look at things like shock, we look at things like stress, the body is energy. And that's what, Einstein had a famous equation, E equals mc squared, right? It's basically energy equals mass times a constant, right? And mass equals energy, right? So this idea of, said another way, energy is mass and mass is energy. And that's basically the whole idea behind quantum physics. Is the energy that underlies that. So you and I and the listener and the table and the chairs and the car are made up of energy. So the power of the mood level, the power of the energy, the power of the vibration that happens is why things like spontaneous remissions are possible, or why things like the story you told about the girl and that experience with her dad, how that the physical could change so quickly when you change the mental or emotional or spiritual aspect of it. Because what we're talking about is, are we treating the ripples in the pond, or are we changing how many stones we throw in? Right. And that's what you look at when you start looking at spiritual levels. Are you working on the stone that's dropping in the lake, or are you
Mhm.
trying to treat the ripples once they're already in the water? Right. And when you start working on the spiritual emotional level, you have a chance to stop those ripples that go through it. One last thing I'll say, and then on that is an analogy I give to patients, is I consider the stress connection. When we look at it as stressors, at nutrition, or as health, kind of how do those things fit together? The example I like to give is the example of a boat, maybe not the Titanic this time, but in the boat is the body and the waves are the stress, right? So the more stress the boat is under, the more it's going to need good nutrition to heal and repair it, right? A boat that's in really high, gale force winds and really high swells, you're going to have to do some more repair after things calm down to repair the boat. A boat that's
Mm.
sitting in the harbor doesn't need a lot of repair. So the nutrient requirements, go back to Roger Williams in the conversation we started, the nutrient requirements will change based on stress. And we know this. Even medical will say, hey, you need more magnesium, you need more calcium as a response to stress, whether that's a digestion issue, whether it's a utilization issue, whether it's, hey, if you drive your car 1,000 miles, you're going to need more petrol, or 1,000 kilometers, you're going to need more petrol, right? You're just going to burn through the stuff, right? It happens. The answer is on so many different levels. The more stress the body's under, the more nutrients it's going to take to recover and heal that. The more we work on that stress level, the better the body's going to be able to heal and repair.
You know what comes to mind when you talk about that? If you grow up as a child and you see a lot of challenging content, let's say online, and then on the back in the days on the TV, on Netflix, whatever that is. In a sense, that's a stress level too, isn't it? Like trying to figure this out, trying to digest that. My wife and I homeschool our 5 kids, and one of the reasons is that we find it challenging, just the input that is coming at school through digital devices. At the moment, we hope that our kids won't touch, digital devices on a regular base, meaning like every other minute, before they're 16. With Steiner, influenza, and all the rest of it. But if I'm just thinking about that in a wider sense, especially with kids growing up in such a digital world where all information is just available, your angle really helps my point of view, which is Look, less is often more. Like I see my
Yeah.
children that watch it, I don't know, something that challenges them, something that scares them. It's often like, like we are really innocent families. So, there's little to no screen time anyway, but something that scared them. Let's see, they saw in a book a monster. And they will figure out to deal with that image in their head, which the fantasies of this monster coming at night and all the rest of it. And I can support the child with it. But if you see multiple monsters moving really real on a screen, that alone would create some stress because they try to make sense out of it. They try to feel safe while being aware of all the different types of monsters. So I remember when my oldest one was 5, I showed her just what it looks like when a lightning goes into a tree. And that looks actually really scary. And ever since, she's 10 now, thunderstorms are not her friends. And that's just one example. And really what I want to say is like, just you have to be really aware that it's really easy to consume. It's really easy to see all these scary things, but there's a repercussion that is actually, if we're not responsible, then we stack all these things on top of it, and the repercussions are just not manageable, I guess.
Yeah. Yeah. And I'll give you the good news of that situation, the light at the end of the tunnel, and a simple way to kind of handle that, because I think you're right. I actually just got married a couple months ago, and my wife and I are at the beginning of that conversation. I think the idea of a homeschool is very appealing for all the reasons you mentioned, and more of just like wanting to be aware of those inputs that happen through a child. And it's not a reality, or that's not practical for a lot of families, but like the question is, how do you handle it if there's some inputs, whether they're homeschooled or not, that are stressful, right? Because that's going to happen for everyone. So there, it reminds me of there's a study based. It came out of UCLA, so University of California in Los Angeles, and what it is, it looked at a functional MRI study. So they're basically looking at people's brains and basically seeing which parts lit up in response to certain stimuli. So they showed one set of images which are things like relaxing, calming, healing. Think of like sunset walks on the beach, things that were just relaxing, and just put the body into that parasympathetic, calming state. And on the other side, they showed them images that would invoke things like terror, fear, things like guns, violence, war, threats. And what they did is, and those would obviously stimulate the sympathetic part of the brain. And what they looked at is, they looked at the functional MRI to see which parts of the brain lit up. So on those relaxing, calming images, like the walk on the beach, the part of the brain that lit up was the prefrontal cortex, which regulates things like rational thought. And in response to the image of things like war and violence, the part of the brain lit up was called the amygdala, which is basically the fear center of the brain. So that all makes sense. That roughly fits with our conventional understanding of the stress and how the brain works. The interesting part of the study is what happened next. So they asked the patient, or the subject in there, to name the mood they were feeling, right? So just tell me, what mood you feel. I feel happy, I feel sad, I feel scared, I feel frightful. Well, what they did is, when the people were feeling happy and calm, the prefrontal cortex stayed lit up, as they named it. When the people were feeling, terrified, fear, showing those violent images, when they asked the person to describe the mood level, the amygdala calmed down, relaxed, and the part of the brain that lit up was the prefrontal cortex. So what they were seeing was a decrease in that automatic fear-based response, and more of the rational thinking in response to that. So just by asking the question, name the mood level, they were changing what part of the brain was fired and what the subject's reaction to it was. Now, how does that work? And I think that question is something, actually, one of the things I do when I wake up in the morning is just ask myself that question, describe my mood level. And obviously, I'd love every day to wake up in a mood level of gratitude, appreciation, happiness, and I do my best to do that. But there's some days it's tired, fatigued, pissed off, angry, but you got to do whatever it is. But I think what's empowering about that study is simply by naming that mood, you're actually separating from it a little. And I think that's actually the example I give to patients. It's, when you're trapped, when you're locked in the bathroom of your house, it's hard to describe the house, right? Or actually, if you step outside the house and walk around, you can actually describe the house. So just by asking the person to name the mood level or describe their mood level, you're actually forcing them to get outside of the mood to describe it. Does that kind of make sense? Like, just to name the fear, you have to step outside the emotion you're feeling and say, oh, wow, I feel fear. And just that moment, you're stepping out, looking back at that mood to name it creates some separation and allows the change in basically the brain function and the biochemistry of the body.
Got it. And I guess also an awareness. So you actually know
Yes.
you can deal with the subject because you actually have it now on your conscious mind. Mm.
Exactly. Yeah, that's it. Yeah, that's it. You're stepping outside of it. So instead of effect of it, you can name it, which is the first step to being at cause over it or just spotting it. It's like if you're in the middle of chaos, sometimes just saying, I feel overwhelmed, like just like you can kind of take a deep breath after that, and then you can begin to just to chunk it one step at a time to see what needs to handle it. But just naming the emotion, naming the mood, brought the awareness to the area, brought consciousness to the area, created some separation, and changed how the brain functioned and changed how the stress system was happening in the body, putting the person or the subject or your daughter, more at cause of it. So the lesson for parents is like when you see your kids going through a moment or hit by that, name the mood, describe the mood you're feeling. I feel scared, Daddy. And then sometimes, you get a release around that. But that would be one way to look at that.
Powerful. And of course, it doesn't stop with children, but even more so, like adults probably don't see the necessity of going back to these thoughts and having an outside look in.
Exactly. It's the same thing. And we talked about that, the adverse childhood experiences. I don't think a shock or trauma just stops happening once we're not a child, right? These same principles we talked about then, that patient was who I just described losing 22 pounds in a couple of weeks. She was probably in her 30s or 40s when that happened. So that idea of a shock affecting the health and leading to weight gain, and same thing. It's the same mechanics that happens as we age. So just like that, the same example we gave with the mood level question to children would apply equally and maybe be, more important as adults, considering, some of our roles in the world, especially as parents, right? Because kids will pick up on the moods we're feeling unconsciously and unawarely because they are incredibly perceptive, amazing beings in small bodies.
Yeah. Small side note. Yeah, my wife and I had a disagreement the other day and we just couldn't figure it out. And then you leave it or whatever. It happens rarely, but that was one of those. And if you have looked into human design, there's some people that are really receptive and really empathic when it comes to that, and others aren't. And sure enough, the most empathetic child of ours was crying in her bed, and I went to her and was like, "What is it?" And she said, "I don't know. Something is wrong. I have no idea what it is. I'm just sad."
Wow.
Sometimes that's just how it is. And I left it sort of there, but I was talking to my wife and it's like, man, not to underestimate what the environment grew up in, even though it has nothing to do with the child. No one has told her off or given her fear. She just really picked up that we were both really deflated because, oh man, we haven't figured out a solution. And normally we're really quick and just finding an agreement. That one wasn't one of those. And it wasn't like we didn't scream or anything like that. We didn't shout at each other. It was just a really, I guess, rational conversation where we just really tried to troubleshoot one disagreement. And, in the end, we got there a couple of hours later. But during that tense moment between us, when we both were deflated, child started crying. So yeah, Jeff, I want to say it's so refreshing talking to you because to me, you point out a lot of solutions because you point out, you give a lot of awareness of solutions that there are and pathways that we can explore, which to me paints sort of a picture of a world that we can get to, because these things, like the world that we live in is pretty free. Yes, there's some censorship around it, and and sometimes like in pandemics, it's extreme and you feel like you're really controlled. But most of the time, we live in a world where these ideas are okay to express. And to me, that's a huge hope that we will figure out a way. And I had so many ideas while talking to you. You were talking about like, you really need to go through a questionnaire. Well, I hope that, that a positive way of using AI is actually that the questionnaire can be really interactive. And therefore, buy AI before they see the doctor, because financially, it's just unfortunately not possible for everyone to pay a doctor for 1 or 2 hours to do that. And many other things, and I found that so uplifting, because I really believe we'll get there. It's just a matter of time.
Yeah, I think that's well said, and I appreciate the kind words there. And I think I inherently am optimistic about human nature and us developing. And I think when you see the pendulum just kind of swings each way. And when you see a lot of repression and fear, I think, that had a lot of negative consequences for a lot of people. And we saw that, in spades over the last 3-4 years, especially referencing the pandemic. And in Australia, you guys had a hell of a time down there, compared to, some parts of the US for sure, and other parts of the world. But I think it has brought, in some level, a rebirth and increased awareness to the importance of things like medical freedom, the importance of having honest, open conversations, even disagreements, right? And just the ability to have those conversations. When there's some dark that moves in, I think it also creates the potential for more light there, or sows the seeds for it, kind of like that yin and yang symbol that comes back from acupuncture. There is always the light and the darkness within the light. So anyway, I'm an optimist on the potential that we all have to create what we want. And I think the work you're doing with this podcast is certainly, a piece of that. And I hope I can contribute to it through the book and some of the work we're doing. And, we align with a lot of other great people out there, and, we do our best to create a world and then release that intention, kind of see where it goes.
Awesome, Jeff. So yeah, you mentioned the book. So Timeless You is definitely one way to start learning more about your mindset and what you're doing and how you see the world. And I think that's a great recommendation to start with. But if people want to connect with you and maybe even do a consultation or a course with you, what's the best way to reach out to you?
Yeah, great. So a couple of things. They have best way to probably find me on Instagram and just my name, Jeff Crippen. We have the book is called Timeless You with a little TH, so Timeless Youth. And that is a play on words, recognizing the number one truth in your health is you. So we put the you in youth, and kind of that timeless you is a nod to the soul or the spirit that we kind of talked about there. So that great place to find me is on Instagram. We teach some courses around presence, gratitude, appreciation, and winning. And just those are foundational pieces to building up ourselves, right? And those get outside the pure areas of nutrients and vitamins and the importance of those. And I certainly do some teaching around that as well. But based on the conversation where that's going, if that's something that grabs your attention, you can message me through the website or Instagram. We'll get you some information on that. And actually, maybe I'll send you a link and we can drop it in there too.
That'll be great.
Okay. Amazing. Awesome. I'll drop that in there. But yeah, those are some of the pieces, because the stronger we can have a self-concept, the more we can build up ourselves and understand ourselves, the stronger it's that the position we can hold, and the easier it is to create some of those areas like health.
Love it. Keep up the good work. Thank you so much for your time, Jeff. Really excited about your work, and looking forward to see where you get to so much. Thank you.
Awesome. Thank you, Sebastian.
We hope you got a lot out of today's inspiring conversation. Please share this episode with someone you know needs to hear it, whether they are a seasoned health expert or just beginning their wellness journey. These stories of remarkable transformation, success, and valuable insights will certainly help empower more people. Until next time, have the best life ever.